Hello, welcome back, everybody. Welcome to Built Different Podcast, the DPT edition. Again, my name is Aaron Kennedy, and this
And
is the
I'm
Keep It.
Dekevis Pear. That's
That's what
right.
I'm
I'm
talking
Dekevis Pear. Yeah,
That's what I'm talking
that's right. I got you.
about. We are current student doctors of physical therapy, and what we're going to be talking about today is just a little bit about the intrinsics of just being in school. And we have a couple of questions that we do want to start off with. So, to keep this, if you got some, I know some people been hitting you up.
Absolutely. We got a lot of great feedback from the last video, and a lot of people asking questions and things of that nature. So we really appreciate that. And that kind of is why we're here. We're here to help you guys get a better understanding of like what the journey is like and things of that nature. So the first one of the first questions we want to talk about was someone asked, what's been the most rewarding experience while we've been in the program so far? Um, and I'll go ahead and answer first. The what I felt like has been the most rewarding experience so far while I've been in the program is just getting a deeper dive into the anatomy and how much it correlates with your everyday life. Just not on a surface level, just like, all right, you exercise to be healthier. It gives you more of a insight as to why, like what it does for you. As far as like the molecules and things of that nature. So you just get like a deeper dive into all that good stuff and how all of this body systems work together to create our great cells.
That, that makes sense. The way that we learn information is like almost immediately applicable to just like everyday like type of situations. I think for me, that is itself the most rewarding part is that
Yeah,
I can take that information, I can immediately apply it in certain areas, just maybe in my own health and fitness journey, but really more so like family members when they ask me about random ailments
de-
and aches and pain. I could be
definitely.
like, oh, this sounds like such and such, or, just use that as an example on how I can actually utilize the information that we're given. It's very rewarding that we can just take our information and just apply it to life.
Absolutely. Absolutely. Okay. Um, that was a great question. The next question that they had for us was, how has expectation versus reality been as far as what you expected to learn in a program versus what you're actually learning throughout the program?
Yeah.
So, what I expected to learn in the program was a deeper dive. Like I already have a PTA background, so I definitely expected to learn more things in depth. So I think that it's been exactly what I thought it was going to be. I didn't know it was going to be this fun though. I enjoy it. I already had a passion for physical therapy, but being able to do it on a DPT level is definitely very exciting, and it's made it much more rewarding again. And I'm excited to get out there and get the opportunity to work with people. So I think that's where it lies with me. What about you, Aaron?
My expectation to learning how to become a doctor of physical therapy, I I only worked in that one setting, an outpatient setting. So I looked up to the physical therapist there. I've told all the patients, I'm like, they're doctors. Like,
Yeah,
y'all need to respect them.
that's right.
Um, but because of that, that was really my only time getting to know the physical therapy setting. I came from a personal trainer background. So I really didn't know like the main differences between what personal trainers do and then what other people do in the health care setting when it comes to physical rehabilitation. I just didn't understand the difference, the vast difference between the two. So
Right.
my expectation, I was like, oh, like we're gonna learn more like MSK related things.
What
That's where we're gonna shine. What's up?
what's MSK? They may not know what MSK
Oh,
is.
musculoskeletal. So we're
Okay.
talking more muscles, bones, those type of injuries or those type of issues and problems. Um, but I thought that's what we were primarily going to be learning, and that's what we'll be focusing on. But we learned so much more neurological. We learned like just sensory deficits. We've learned so much more than just muscles and bones in order
Right.
to help any type of patient that walks into our clinic. So it's very exciting. The vastness, I get excited.
Yeah, literally, it's like it's just so fun. Like you said, applying it to our lives. Like when we go to the gym, you now can think about like your aerobic system. You know, what kind of testing are you doing to yourself like throughout the workouts? Because usually you just go in the gym and you're like, all right, I know what I'm gonna do. But when you know how to push those muscles and those parts of your body a little bit more, it makes it much more fun. You pay attention to detail of yourself. So I definitely appreciate that aspect of it. Okay.
I do have a question for you.
Okay, go for it.
This came from a couple of questions. People reached me out as well, but they were primarily concerned about how we prepare for case studies and how do we prepare for lab immersion specifically. Um, they think of the hybrid program and that kind of makes them a little uneasy. Do you have any advice or your own way of
Yeah.
preparing for that?
Um, so during the case studies and lab immersions and things of that nature, is really good because we all get to come together. And the best part about that is like when you and I get together, we practice together, so we actually get a body to practice on before we do the cases, and then we could talk out the cases as well, like rationale, talk about why something is better than something else, contraindications and things of that nature, and we try to come out with the best outcome. And it just allows you to put hands and eyes together because usually when we're apart, since it's a hybrid program, we don't really get the body. We just mostly just get to look at the information on, our computers or piece of paper. So being able to apply those skills on each other is what really helps us. And when we do that, we usually come together, we work on each other, then we just go home and then kind of look at the information. So you get both aspects of it, and that's really how we prepare. So
Yeah, just to add even more to that, I really like the fact that we look at a material so intensively before we get to
right,
lab. So once we get introduced to like a skill or a task, we know a lot of background information about it, but the hands-on skill set we get to develop right then. And the people that we are working with will give you immediate feedback. If you're not mobilizing like the right way, someone's
right,
gonna tell you.
right. That's right. They'd be like, "Oh, that hurt. That don't feel right."
Get off me. Get off.
Pretty much, yeah, just like that.
But it's better to know right then and there instead of going to like clinical rotations or just furthering your career and not being able to pull back from those memories and be like, okay, I have better tactile cues now in order
Right,
to provide the care necessary. So yeah.
absolutely. Rod, I like this question that they have for us next. It's a really good one, because I'm sure it's coming up soon before we go out to clinicals. They're
Mhm.
going to be talking to us about stuff like this. So this next one is, both of you guys come off as pretty confident guys. Are you ready to handle the difficult patients that come with your abilities and possibly treat you as less than the 4%? So I think that's a great question because it's a challenge, right? You don't think when you do a profession, you think that you're just going into it for the professional aspect, but having people that, view you in different ways and whatever traumatic experiences they've been through, I think that's really good because it challenges us in different ways. So being able to hold our composure and things of that nature, I am ready for that kind of challenge because when I signed up for healthcare, I understand that I will be working with people of different backgrounds, different ethnicities, all kinds of things. So um, I'm here for it. So
Yeah.
100%. So whoever that patient is, I'll see you soon. Yeah, yeah, yeah,
Not you pull it
yeah,
up.
for real.
Me, I resonate with that, Dickies. I really do because I mean, it's true. People are going to treat us some type of way just from face value. They're not really going to see the knowledge and skills and what we bring to the table before. we're able to pretty much perform and give them the good interventions that they need. But, it's going to happen regardless. That's not going to affect the way that I will treat that individual. That's not going to affect the way that I treat anybody else. You're still going to get Dr. Aaron J. Kennedy,
Yeah,
DPT. Like you're still going to get that type of person from
right.
me. There's already been situations as a physical therapy aide when I was that people looked down on me even more than that, treated me less than the 4% than that. So
Yeah,
it's when I was in the military, same thing.
yeah,
It's not something where you're going to walk into the space and not think that that's not a possibility for it to happen, no matter what level of academia that you are, no matter how much you climb up the ladder. So our confidence is our weapon to combat that.
hmm,
Because, well, not only our confidence, but our professionalism as well.
yeah,
It, it's important to be mindful and know that we represent something bigger than us at all times, whether that is a weight someone wants to carry or not. It is our weight. And I think that you and I do it pretty well.
yeah.
And hopefully we inspire other people to take that challenge with full confidence and pull up on them.
Full up, full up. But I love that though. Just to reiterate what you were saying though, it definitely won't cause me to change who I am at all. I continue to be, Dr. DeKevis Perry when I am, and just give him my all. I give him 110% regardless of, age, color, whatever the case may be. So I definitely look forward to it. I look at it as a experience that I can learn from and grow from. So I'm looking for that opportunity when it comes.
You know, were there any type of moments where you felt like that was on full display? Like, was there a moment where you kind of felt like this is this is an example of that question that you asked, like happening, and how did you navigate that moment?
Oh man, I have had experience like that, but I'll make it short and sweet. I won't go into too much detail. But during PTA school, when I was doing my first rotation, actually, I had home health, and I was in a really wealthy area here in Tennessee, and I had a patient who initially, like, started out with, I introduced myself, my name is DeKevis, things of that nature, and his daughter was actually a labor and delivery nurse and she was there as well, but she wasn't, his caregiver or anything. And the patient had ALS, but it was the very early stages, and they had came here from California. And while I was there, how I told him my name and everything, and he said like it sounds like a African name and all this other thing. I was just like, and then his daughter was even like, Dad, what are like what are you talking about? Like, so it was that, and then he had went like political with it, start saying things about politics, and I just kind of brushed it off. I understand what's going on. I'm there to help him with what he has going on. So all the things that he was saying has nothing to do with what we're doing. It definitely makes me think about it, but at the end of the day, you got to think about the big picture. Like, why are you there? You're there to help them and improve where they are in life. And if you know what ALS is, it's like a progressive disorder where things are gonna get much worse before they get better. So I'm there to help them with that more than anything. And yeah, by the end of the time I was working with him, um, he was very appreciative and he told me, he apologizes for however he came off in the beginning. And just hearing that kind of was much more rewarding than anything, especially with that being my first rotation. So yeah, I enjoyed it. There was a downside at the beginning, right? But at the end of it, I came and I conquered what I was trying to do. I was trying to um, get him better generally. So it was very rewarding for me. And I think about that all the time too. So that was a great experience.
Sounds like a powerful experience, just kind of reaffirming, regardless of what other people and their other perspectives, is that you belong in this space. Like you have a purpose within this space. So I'm glad it didn't cause you to be like, hey, okay, well, this is it for me.
Yeah, definitely. 'Cause I could have easily been like, nah, I think this is what I want to do, you know. It was awesome. And his daughter even said, thank you for dealing with my dad. I know he's a tough patient. Things of that nature. So that really, just made it all come together. And I walked out of there like I did something today. I know I changed something, you know. So that
Mhm.
was awesome. Um, you want to keep going with the questions, or you kind of want to
I
switch
mean,
over here?
for the people who are listening, we love these questions and we could go all day answering
Yeah,
these questions. So please, like, continue to send Akivas or myself questions. And what
right.
we're going to try to do is open up and answer a couple of them.
Mhm.
But we definitely want to keep on going with our podcast and what we have on the schedule today. So let's go ahead and continue with that. What we were really trying to focus on is just the day in the life of what our PT school looks like being in a hybrid program. And the way that I want to start this off is, what does a typical day look like for us? So, and I'll start off myself. Uh, I wake up 4 in the morning, go to the gym, get a good workout in, and then for the rest of that time, I'm studying until class time, studying until what it's 12 on the East Coast for me. I'm in Virginia, and then take a little break, and then study some more until the next class, three, if we have two classes in a day, and then continue studying until I pass out. That is my life as a hybrid program
Mhm.
student.
Hey, hey, man, it's not easy. It's really not. It's really not. So for me, what the day in the life looks like, it just depends on the day, really. So I kind of start off occasionally. I try to do what Aaron does, but I know he does it daily. So I wake up in the mornings for sure. I get there. If I hit the gym in the morning, I get there about 5, and I'll stay till about 7:30, 8. So I'm there. Then I'll go to work where I'll work for a couple hours, study right before class, and then we have two classes a day. So we have one at 11 a.m. and then 2 p.m. So studying in between and just preparing for that. And then once I get off the second class, I usually try to dive right back into my studies. If I didn't go to the gym in the morning, I'll go to the gym in the evening. And then once I get through at the gym, I'll just come right back to the studies. So that's pretty much like how it goes in a nutshell. Uh, as you can see, studying is the biggest thing because we don't have teachers. We're not going to lectures or anything like that. During our class time, they're talking about the information that we should have already addressed before we get there. So it's kind of, in a way, self-taught. But if you have questions, they are very open to emails and setting up Zoom meetings and things of that nature. And they also have as we mentioned before, like the student hours where they open up for a whole hour and they're answering whatever questions you have for them. So you have all that opportunity to learn. So that's what it looks like for me.
Yeah, we stay pretty busy throughout the week. They have plenty of material for us to go through. There's not a moment in time where it's like, I really don't have anything to do. I don't know if you ever felt like
No, oh no,
that.
no. There's plenty. There's plenty I could be doing.
Shout out the cardio, right?
Oh man. Hey, shout out to Dr. Stroud. Shout out to Dr. Stroud.
He wanted me to say that's the best class.
He did. He did say that.
But I mean, even though we do have a surplus of material, especially right now, I don't think the acceleration hit me really until like towards the end of last quarter. But
Yeah.
I really feel it right now. And it could be just me,
No,
but
it's not. Me too. It's definitely not just you.
things are going so quickly, and it's just such a large amount of material. My head is spinning in all different directions, just trying to stay the course. But you know, I I'm still finding ways to digest things. I don't quite understand how I'm able to do that, but I feel like their program is programming. It's
Oh
working.
man. Seriously though, and that's exactly what it's doing. It's forcing us to lock in, as we talked about before. Like you really have to take advantage of the time you have. So don't let any moments go by without you knowing what you're gonna be doing, kind of thing. So definitely, I agree with that. Um, let's see. What did you wish you knew before starting PT school? Anything since we've been in here? Anything you wish you knew before we started?
You know, anatomy has to be like our strong point. Like I feel like every PT student, anatomy has to be like what you're good at.
Yeah,
So I wish I knew the physiology more than just the surface level anatomy.
yeah.
Um, just because when you're talking about like muscle ligaments,
Hmm.
tendons, yes, I can identify those. I know that. I know insertions, you know, innervations. I know that.
Yeah.
But the physiology, you know, like the circle of Willis. Tell me about the
Right.
circle. Tell me about the circle of Willis,
Right.
or the brachial plexus. So, you know,
Right.
just
Oh
understanding,
man.
like, you know, it's just it all it all adds up because the way that we talk about classes now, us, what is this? Our fourth quarter, I believe. I think it's
Hmm.
our fourth quarter. The way that we talk about information now, it's not necessarily assuming that you know this information. It's like you should like at this point you do know this information. So if I'm
Right.
able to present you with a case, you need to
Yeah.
be able to understand like what I'm saying at this
Right.
point. So
Yeah.
if in the very beginning, I think I would have wanted to emphasize a little bit more on the physiology side of things with the
Mhm.
anatomy. And, but you still learn. They'll teach you. But what
Right.
about you?
Yeah. I think I'm the same way. I wish I had a new, like, deeper. Maybe I need to take like a biology course, like a advanced biology or something, because that was something that was a little bit of a curve, especially when we first came in with another cardio class with Dr. Stroud. I was like, I mean, I know the flow of the heart, but uh, all right now. So it was a lot with that for sure, but I've enjoyed it. Again, I've enjoyed the journey, so I have no complaints there.
Would you say there was a maybe a turning point where you felt like, yes, this is exactly like where I want to be at, even with the sheer amount of volume of work and things that we have. But was there a moment where you're like, oh no, like, yeah, I'm here.
The turning point, I think. I don't think I can say there was because I always felt like that. I feel like I'm exactly where I'm supposed to be. You know what I mean? So especially if if you're a believer, God makes no
Mhm.
mistakes. So I know
Amen.
I'm exactly where He wants me to be at. So
Praise God.
yeah, absolutely, absolutely. How about you? Did you ever feel like there was a turning point for you?
Uh, Not necessarily a turning point. I would say there was a big confirmation after second quarter. First
Hmm.
quarter, that was more like to me just really the anatomy and physiology. Yeah, some of those courses like were a little tough, but I wasn't sitting there and being like, okay, I'm not confident in my skill set already for that. But it's more like the second quarter when we start really getting into more PT specific like
Yeah,
type of coursework. And I was understanding things and able to apply things and just understand, you know, having conversations on a higher level than what I'm used to
yeah,
coming from a fuels, background.
yeah,
So that was the confirmation for me to be like, okay, I
yeah,
can, I really am exactly
yeah,
where I need to be, and and
yeah,
I am a believer myself, so I know God doesn't make any mistakes.
yeah,
So I'm here for a reason, but
yeah.
sometimes I need a little.
Reassurance. Yeah. I kind of want to go on that a little bit more. So, I'm gonna dive a little deeper. So I do definitely think that there was a turning point now that I think about it. So I won't, not a full turning point, but um, like learning the different topics, like learning neuro, learning cardio pulm, learning all these different things. I think like being able to put it all together, because you can see a patient who's for cardio and then they have other deficits that has a stroke, that has, different things going on. I think being able to put all of them together and make it into a very like creative treatment plan for them that's safe. I think that takes true skill, and I like to think critically. So I think when I was able to do that, or when we do our case studies and things of that nature, that kind of made me like, oh my goodness, this stuff is awesome. Like, I love this right here because I don't know, I just love the creativity, and it allows you to, put a little bit of your personality in there too. You get to challenge the patient as well as yourself with how applicable you can make the exercises for the patient. So it's like I'm really showing my expertise, like doing this. Like you can't just find this on the internet. You know what I mean? This is why I am who I am, kind of thing. So I really enjoy that for sure. And that might have been my turning point, I guess.
Listeners, y'all need to know one thing about this man right here. Let me tell y'all one thing about this man. We are in lab immersion. And I'm sitting there. I don't know what's going on with this case. They hit me with a neuro, with a muscular skeletal issue, and
Right.
patient can't communicate at the same time. I don't know what's going on with this patient.
Bruh, everything. You like
Here comes, I'm gonna say it, Dr. Dakivas Ferry.
stop it.
Here comes the guy, the man, and he started giving me a plan. Let's not talk about explaining what's going on. he's, he's giving me a plan. This is what we'll do first. This is what we'll do second. So I'm just saying it's amazing to see like other people and their skills and their talents and you my brother, my friend, you have an amazing skill to analyze, especially like during cases, and understand like treatment procedures and intervention strategies. So listeners, that y'all need to lock in with
Man,
that guy right there.
so does he. Don't let him sit here and say all this without telling you what he does. He's literally critical thinking. He'll break it all the way down for you. Like, this is why we're doing this. He's great. Literally, he speaks up for the whole class all the time. So I'm telling you, he is the guy. If y'all want to reach out to anybody, hey, Captain. They call him Captain for a reason. They call him Captain for a reason.
Look. Look, I even got my team shirt with me.
You see what I'm saying? Look, and guess who created him? He created the shirt. He
Shout out to
created.
the expert. Shout out to
There you go. There you go. All
But
right.
would you say like even though all this stuff is going on, the have you found outside of us camaraderie, just with other people, or just you were able to build like professional relationships, networking? Like how does that go in your perspective while you're a student?
Yeah, I definitely have. So big thing for me this past quarter, we learned a lot about like TMJ, and what TMJ is say it's more so with the jaw, right? So it's something called temporomandibular, like it's a dysfunction within the jaw, and it's applicable for people that are in dentistry as well. So I have a couple friends that work in dentistry, and it was just very good for me to connect with them in order to talk about that. So it was like that camaraderie made me feel like, wow, I really am learning some good stuff because I can talk to my friends that are in a different field about medical things as well. So they could refer patients to me and I can refer patients to them as well. So that's really good. And then also working with nurses and things of that nature, you can kind of talk to them about the conditions that are going on with the patients, so we're not just before we go in, we can take a blood pressure, we can find out what a pulse ox is. All these things are the same things that nurses and things of that nature do, like just to get a baseline for the patient. And us, we understand that as well. So it's like, okay, so what's going on with the patient? Why are they here? It just kind of makes it a closer bond, and I trust them and they trust me with the patient as well in order to take the best care of the patient. So those are my, I'll say, two right there. Also, OT, they're great as well. I got to shout out to OT, our speech, our SLPs, our speech therapists as well. Uh, so great, absolutely.
We love y'all.
Facts, facts.
I have found like opportunities in order to make interdisciplinary connections. So being able to just be understanding of what other people contribute to a patient outside of
Yeah,
just physical therapy. I really didn't know that much going into the program. I didn't know like how much we are a part of a team in certain settings,
hmm
especially like acute care and patient care.
right.
Um, you're working with a speech pathologist, you're working with OT, and you're working with their primary care provider as well, just making sure information gets to whoever it needs to get. Um, I also like the fact as students, we do get to have that ability to network with our more advanced DPTs out there. So that
Yeah,
includes our staff, our professors, but that also includes like the people that they are connected with. So it gives us an opportunity to really see like the diversity within the profession of all the skills that we can do. That's very exciting for me. Like you're talking about TMJ.
yeah.
I'm not doing no TMJ. I'm gonna learn, of course, but I'm
Yeah.
not going. That's not. I don't think that's for me right now. I don't but I know how to do it. That's the whole point. I
Yeah.
know. I know. At least I'm familiar. I'm familiar with it, but like sports, we've met so many people who have worked sports before, whether it's sport specific or just a general population of sports. We met people who pelvic floor health as well. There's just so many things our profession can do,
Yeah.
and that to me is just one of the most exciting things about being a physical therapist. It really is.
Absolutely. Man, it's been a good one. Another good one for us, man. I
Yeah.
want I want to say thank you for coming on today again. Partner in crime right here. So, if you guys have any other questions, y'all continue to just send them to us. Send them to Aaron, myself, to our Built Different podcast page. We would greatly appreciate all the questions. If you want to give us information that you have, not only just ask us, we are accepting that as well. So thank y'all. Don't forget to like, share, and subscribe. We really appreciate it. So, you have anything else, Aaron?
No, get
Yeah,
some rest, study up. Thank y'all
that's
for
right.
listening to us. We'll see y'all next time.
All right.